We hear about it all the time, the opioid crisis in BC, but how bad is it? Dr. Karen Goodison with Interior Health talks about local numbers.
We continue to have high numbers of people dying of overdoses related to illicit drugs and related to, the fentanyl and other contaminants that are in the current drug supply. So we do continue to see high rates with almost one person per day dying in the interior.
In December alone, paramedics in the interior responded to 225 overdose events and 213 the month before.
If we look back to 2016, when the emergency was first declared, a public health emergency around the opioid crisis, then we saw an increasing number of overdoses continue for the next year. We saw that stabilize over 2017-18, and then actually the numbers of people dying from overdoses decreased in 2019.
But Goodison says the pandemic has caused those numbers to go back up. Kelowna RCMP Corporal Jocelyn Noseworthy.
People in crisis aren't responding well to this increased pressure. It's hard on all of us, but those who are already struggling are finding the struggle worse.
An average of 3.83 people per 100,000 die by illicit drug overdose in IH, sitting much higher than the provincial average of 2.98. So who is most affected? Data from the BC Centre for Disease Control shows men are much more likely to overdose than women. And despite 19 to 39-year-olds making up the majority of overdoses, most overdose deaths occur in people aged 40 to 59. According to the BC Coroner Service, Kelowna saw a total of 61 illicit drug deaths last year, more than two-thirds of which involved fentanyl. Corporal Noseworthy says fentanyl is just one of several drugs commonly found in the city.
Probably the most common street-level drugs that we're seeing right now are crystal methamphetamine. We see crack cocaine, and we're seeing combinations of fentanyl and heroin.
Illicit drug overdose deaths in Kelowna make up more than a fifth of all interior health illicit drug fatalities in 2020, but only a fraction of the more than 1,700 that occurred across the province, a 74% increase over 2019. Kelowna sits fifth in BC townships with the most illicit drug toxicity deaths for 2020. For AM 1150's Early Edition, I'm Brittany Webster. Kelowna is no stranger to the opioid crisis that has taken hold in BC. 2 drug alerts have been issued for the city this month. Dr. Karen Goodison, a medical health officer with Interior Health, says the latest was issued February 6th.
The recent one in Kelowna described a light blue powder and a dark blue powder that contained, people were buying it and they thought it was either down or fentanyl or heroin, and it actually contained fentanyl and benzodiazepines.
Goodison says drug alerts are issued when any drug testing shows contamination in a drug that could increase risk of overdose, or a notice comes in from the RCMP.
They generally stay in effect for a week. We recognize that drugs do change over time, and so this ongoing testing and letting people know what's in the currently circulating drugs is an effective way to let people know any additional steps they can take to stay safe.
Benzodiazepines are one of the top culprits locally. The other is fentanyl. Dr. Jane Buxton, medical lead for harm reduction at BC Centre for Disease Control, says it's a fast-acting, dangerous substance.
Fentanyl not only is a very toxic drug, but it works very quickly. So if somebody overdoses and they stop breathing, there's no oxygen really getting to the brain, and that's the concern.
More than 80% of overdose deaths last year contained fentanyl or its analogs. So how and where can you get your drugs checked? Dr. Goodison says locally you can go to Living Positive Resource Centre, the Bridge Outreach, or UBC's Harm Reduction Program to make sure the drugs are safe. Don't let police be the reason you don't test your drugs. Kelowna RCMP Corporal Jocelyn Noseworthy says they aren't out to get you.
In Canada, we're more interested in safety than anything else. We'd certainly encourage people, to do what you can to keep safe. Above and beyond, we'd like to see everyone healthy and not have addiction issues. But we're certainly not out there hunting for those people that are trying to ensure their own safety.
Minister for Mental Health and Addictions, Sheila Malcolmson, says the province continues to work towards decriminalizing personal possession. For AM 1150's Early Edition, I'm Brittany Webster. You take the first aid courses, not necessarily expecting to ever put them into practice. But I put mine to use for the first time this month, after an evening outing to a 24/7 convenience store turned into assisting in a drug overdose while waiting for paramedics to arrive. I spoke with Leon Baranowski from BC Emergency Health Services on being a witness to an overdose. The public stepping up to assist in medical emergencies can make a big difference.
Public do assist in supporting patients prior to paramedic arrival, often at the direction of our emergency call takers.
Baranowski says if you witness a medical emergency, the first thing to do is call 911. Dispatchers can coach you on how to best assist.
This is really a chain of survival, and everybody has a role to play, be it the member of public who puts in that 911 call and starts CPR, all the way through to the management and the direction and advice that the call taker provides, to the early dispatch of resources by our dispatch colleagues and first responders, all the way to paramedic arrival, all the way through down to hospital.
That's what I did in my bystander experience. 911 was called and the dispatcher walked me through the necessary actions. Thankfully, CPR wasn't required, but I was prepared to do whatever necessary. Baranowski says it's a life-saving measure anyone can perform.
Basically, in cardiac arrest, your heart is not pumping blood around the body. And so when blood is not circulating around the body, oxygen is not getting to all of the vital organs that it needs to keep us all functioning. So jumping on someone's chest and doing CPR basically helps pump that blood around the body, and any oxygen that happens to be remaining in the body continues to be circulated.
A person's chance of survival lessens by 10% for every minute CPR isn't administered. What might deter someone from helping? Baranowski says the COVID pandemic is definitely a barrier, but mouth-to-mouth isn't actually required.
A lot of research has been done now looking at the chain of survival. And what we know is that bystander-initiated CPR and the early use of an AED can increase that chance of survival by up to 75%. And so just putting your hands on someone's chest and undertaking CPR can make all the difference. And mouth-to-mouth isn't necessarily needed in a large majority of these cases.
For AM 1150's Early Edition, I'm Brittany Webster. Naloxone kits are brought up often in discussions around the opioid crisis. But what are they? Where can you find one? And how do they work? Dr. Jane Buxton with the BC Centre for Disease Control.
When somebody overdoses with an opioid, too much in their system, their breathing slows and may stop. Naloxone comes along and interferes with the action on the brain, pushes the opioid off the receptor, and a person will start breathing again.
So naloxone can reverse the effect of opioids. But what's actually in the kit? Aside from medication, Buxton says it has gloves and basic instructions, and they've taken user safety into account.
It has 3 safety needles. So with the ampules, you pull up into the syringe, and then when you administer the syringe, the naloxone, the safety needle retracts back into the syringe, so there's no risk of needle stick injury.
The BC CDC promotes use of naloxone kits on their Toward the Heart website. It offers video tutorials on using the kit and where to find one locally, like for free at most pharmacies. Leon Baranowski with BC Emergency Health Services says naloxone may not be enough.
Reaching for a naloxone kit obviously has its advantages, but really, what's most important is keeping that blood circulating through the body, and then calling 911 so the professionals can arrive. And in the case of overdose, that might be providing emergency breaths and breathing for the patient, or taking over the CPR that you've already started.
And in some cases, Chief Coroner Lisa Lapointe says naloxone isn't effective at all.
We know from our partners in BC Ambulance Service that it is very, very challenging at times to reverse the impacts of an overdose. They're not always able to. The naloxone is not effective despite repeated doses. And we are starting to see more benzodiazepines on the market.
Naloxone doesn't reverse the effects of benzodiazepines. Dr. Buxton says it could restore the breathing while the person remains unconscious.
They're breathing, they're getting oxygen to their brain, but they may not wake up. And this has been a concern that sometimes people have given lots and lots of doses of naloxone when actually the breathing has returned and the person is drowsy or not awake because they have benzodiazepines on board.
For AM 1150's Early Edition, I'm Brittany Webster. With the opioid crisis worsening, knowing where to get help is so important. But accessing care can be a challenge. Doug McKenzie, owner of Options Okanagan, a private addiction treatment center, says there aren't enough government-funded treatment beds available, and many people just don't have the money to get into a private facility.
You reached out today for help, you might have to wait 3, 4, 5 weeks to get into detox. And then once you finish your detox, you might have to wait upwards of 6 to 8 weeks to get into treatment.
McKenzie says the lack of beds is a problem countrywide, but at least Kelowna has options.
We're fortunate that we actually have a government-funded detox. A lot of cities don't have them. Like smaller cities don't have government-funded detoxes, or some don't have government-funded treatment, like Victoria or Cowichan Valley, Duncan, Nanaimo, places like that. They don't have the same access as we do. But our government-funded systems are still so overwhelmed with wait lists because the demand is so high.
Fahmi Baharudin with Living Positive Resource Center says even with government-funded options locally, some people don't have any way of getting to treatment.
Kelowna isn't the most friendly in terms of geographics for those who don't have access to vehicle. And one of the biggest concerns that we have is the geographical reach, means that a lot of our clients because we're set up in downtown, and not all of our clientele are downtown. So it does cause a little bit of an issue because sometimes people just can't make it to the office space.
Baharudin says if you're looking for addiction supports, a great place to start is giving them a call. Living Positive is partnered with several organizations in the city.
The biggest one is obviously through Interior Health. Interior Health has hotlines and stuff like that you can get in touch with them, and they can connect you to the right places. I know the Bridge Youth and Family Services in Rutland is also a great resource to have, and you can call in and they'll be able to connect you with the right people.
Trying to support someone struggling with drug use? The professionals agree. Normalizing the conversation to end stigmas around drug use is key, and decriminalizing personal possession could have a big impact. Chief Coroner Lisa Lapointe.
Decriminalization of itself is not going to change this in a major way, but it is an essential piece to changing the trajectory from one of a law enforcement punishing approach to a medical supporting, let's help you get better approach.
For AM 1150's Early Edition, I'm Brittany Webster.